have taken time on a Sunday especially to share knowledge. So we will wait for a couple of more minutes for people to join and then we will go ahead. Okay, just for 5 minutes we will wait. Good morning, everyone. Good morning. I see the messages, good morning messages are coming up. I hope everybody is doing well and also everybody has had their breakfast. So you can always message me. The chat option is active. So whatever queries, whatever doubts you have, whatever you want to tell me, you can always message me here. So after the session, we will definitely take up all your queries. Wait for 3 more minutes and then I will introduce and I will just give you a brief on how the session is going to look like. I can see that people are joining from their workplaces. Really nice and great to see this dedication. I'm sure this will be a very informative session. So the gut and like your brain, how is it connected and what are we going to like with regard to food, how do we take care about this? And what are the things which you need to like keep in mind to keep your gut healthy so that your brain is also healthy. So we will keep discussing on this topic for the whole as of today. Yes, let's just wait for a couple of more minutes. I see people are joining in. So let me introduce myself. My name is Rumaya and I'm an health coach in SugarFit. So I have an experience in nutrition field for the past like 15 plus years. I have been associated with SugarFit also for quite some time now, long period of time, I would say. So it's really great to see you all today in this session. So as you can see on the screen, we will be talking about the gut, which is your second brain is what we call the gut. So we will be discussing about this. So let me take it ahead from here onwards. First 30 minutes, we will be discussing about the topic. And meanwhile, if you come up with any kind of like queries, any questions, you can please feel free to drop it on the chat window. We will take up all your questions after 30 minutes, after the presentation is over. So yeah, a small question to begin with. Okay, so what is gut? So I want all of you to like answer either A, B, C, D. Just put it in the chat window so that I know, and I'm sure by the end of it, you will get your answers. So A is GI, gastrointestinal tract, B is stomach, C is intestine, D is all of the above. Okay. I can see people are messaging. So I want all of you to take this up. So let's understand like who knows what is gut. Yeah, okay. I'll go with the next slide now. So a little introduction on like nervous system. So why I'm talking about nervous system, because we know that okay, our nervous system is primarily like classified into these many things. Like you can see peripheral nervous system and central nervous system. So under peripheral nervous system, we have something which is related to like gut. There is something called as enteric nervous system. If you see towards the end, like from peripheral, it is autonomic, somatic, and visceral. And from autonomic, we have sympathetic, parasympathetic, and enteric nervous system. So it's a little like in detail, and a lot of like terminologies used here might not be like very like common man language, but this is just to like touch upon a little physiology behind it. So now here, if you see, we were talking about gut, right? So you can see here, okay, let me go back. So digestive system, like in our human body, starts right from the mouth. So if you can see this picture here, mouth, salivary glands, and then the esophagus, and then there is stomach, then there is liver, gallbladder, pancreas, and the large intestine and the small intestine, rectum, appendix, and then the anus. So the food business kind of like starts from the mouth and it ends with anus over here. So now what is gut? So if you see in this picture, the pylorus, which is definitely present in the stomach, like towards the end of the stomach, you get this pylorus. So from pylorus, the whole activity which happens with regard to food till anus is called gut. So we will definitely be talking about what are the actions of gut and what is basically like the gut microbiome or gut microbes, or what is the bacteria and its effect. So let's understand what is like the gut brain connection. So why do we call the gut or the microbiome or a microbiota as the second brain? So if you see here, the signals are like quite in like clockwise, I would say. So brain kind of like influences on motility, secretion, nutrient delivery, and microbial balance. So if your brain is healthy, you are in a like a better space with regard to your brain. The activity of your food or the secretion of enzymes which are necessary for nutrient absorption or metabolism or nutrient delivery for that matter, or the microbiome balance, or the all the microorganisms which are kind of like healthy, which are required by our system, is kind of like directly related to the brain. And similarly, the influence on the neurotransmitters, like the brain actions, are also largely like, carried over with the help of the microbiota or the microbiome which is present in your gut. So neurotransmitters or stress or anxiety, I would say, or mood behavior, all these things influences your brain. Like if you are having a like a bad stomach or you have a gastric issue, you always see like you can correlate your situations as well. The moment you are stressed or the moment you're not feeling good, you see your intestinal function is also not so great. So might be some people like who are experiencing irritable bowel syndrome or any other gut issue. They see that the moment you are stressed or a lot of tension, or you are low on mood, or there is anxiety, you can see that your gut is also not functioning at its max. So why is this kind of like behavior happening? Because we know our gut and brain are like directly very related. So let me just show you like how are these like pathways related. You can see there are three main ways by which are kind of like a neural. These are the nerve cells which kind of like carry messages between the gut and the brain. And there is hormonal. So basically, hypothalamus, like our brain, kind of like the axis releases a lot of hormones that impact the brain function. Again, it is kind of like directly related to your gut. And there is a lot of like immune cells. So if you see here, there is nerve, there is immune cells, there is intestinal epithelial cells, there is gut microbiomes. These are then the metabolites from the microbes, and all of these are kind of like very much interrelated, because the immune system or the immune cells signals, I mean, these are like kind of like signals which are used to communicate between the gut and the brain. So there are three pathways for the bacteria to send signals to the brain as well. Okay. Huh. So what is gut flora or gut microbiome or microbiota? There are billions, I would say, microorganisms which live in our intestine. So they are again classified into different species depending on the names and appearances. So there is dominant species, there is rare species, there is transient species. Again, we will not get into the details of the names, but definitely there is a vast classification of microbiome. We will definitely talk about this classification based on what it is. So let's just understand, why is the gut microbiome a key for your health, right? So that it has like four main functions to play. So first, if you see, it promotes digestion by facilitating the absorption of nutrients. So you understood what is gut. So basically, the first question which I asked you, like what is gut? The intestine, the GI tract, or the large intestine or small intestine, all of those consider the whole of gut. So all the absorption of the nutrients are happening in this gut part. So the gut microbiome or the bacteria or the microorganisms which is present in our gut kind of like promotes the digestion by facilitating the absorption of nutrients, which again helps the digestive tract to function properly. And it creates a barrier against pathogens and toxins. Like if the gut microbiome is healthy, then we know our I would say immune system is also healthy, because it plays a defensive role in the development of immune system. So to keep our immune system stronger, we definitely have to work on the gut microbiome, right? So what are the symptoms of like dysbiosis? So if there is no like good balance maintained in the gut, what will happen? Like how do we take care about it? Like what are the symptoms by which we know that, okay, the gut is not functioning to its max? So if you can see here, few of them I have just like pointed it out, like chronic fatigue. Like some of you might complain on like, oh, I just feel tired very quickly. It could be due to a lack of like good microbiome in your system. It could be digestive problems, like you might end up having loose stools as soon as you eat, or you might complain on constipation. So any kind of digestive problems are associated with gut microbiome. Trouble urinating or acid reflux or heartburn, like all the symptoms of gastric issue. Vaginal or rectal infections or itching, again this is a sign of like not so good gut being maintained. Food intolerance, gas and bloating, and there is inflammation and aching joints. So it could be, there could be some kind of like swelling in your body or in your joints, and some kind of like pain as well, aching joints. Like when you wake up in the morning, a lot of you might complain, okay, there is a back pain, there is knee pain, there is leg pain. So that this could also be related to the gut microbiome. And then there is acne, the skin rashes, and psoriasis issue. ADHD, attention deficit disorder, or issues with concentration are also associated with dysbiosis. Or, as I said, irritable inflammatory bowel disease or irritable bowel syndrome are again associated with dysbiosis. Diabetes or obesity, cancer, cardiovascular problems, central nervous system disorders, anxiety, depression, all these are kind of like dysbiosis will result in any of these conditions or all of these conditions as well. So as simple as the microorganisms which are healthy, which are present in our gut, are kind of like responsible for like very simple issues to a very like complicated issue, till cancer or diabetes or obesity also it kind of like impacts. So what are the factors which affect the gut health? So there are many. We definitely know our eating schedule. Our diet is something which directly has an impact on the gut microbiome or gut health. So as much as possible, concentrating on balanced eating routine or a healthy nutritious diet you're following kind of like helps in good gut microbiome. And then the stress, so it could be like any kind of stress. It could be like work related, personal. See, day in day out, we all are like normal human beings. We kind of like come across stress, but then we need to focus on what are the things which will help us manage stress so that it is not impacting our gut. As I said, gut and brain directly are very related to each other. The moment you are stressed or you're not sleeping well, or there is any other like specific issue with regard to your daily routine, it kind of like impacts on your gut directly. And the other also the factors are like infant feeding formula. So we see that okay, during birthing, the birthing process also kind of like has an impact on the microbiome or on the gut. This is largely like natural vaginal birth. You see the gut microbiome is so much more healthier because it is passed on from the mother, whereas the C-section babies will not have such a good healthy gut microbiome. Similarly, infant feeding methods as well, because if they are on bottle feeds or formula feeds, they might not have a very healthy gut microbiome. It kind of like starts from the birthing process. So the infants who are breastfed will definitely have a better gut microbiome. And life cycle stages also has a like a huge influence on your gut microbiome, like the infancy, the adolescent age, the older age. All of these things definitely have a strong impact on your gut microbiome, and also where you stay, like the geography or the urban rural areas where you're staying, that also has a huge impact on your gut microbiome. And the pharmaceuticals, so basically the medications which you take, or largely I can speak about antibiotics which you take, that kind of like has a capacity to kill a lot of like healthy cells as well in our system. So unnecessary taking or popping up medication is definitely not a great idea when we talk about gut health. So let's just discuss on how to improve your gut microbiome health. We know what are the causes. We know what can definitely impact on the microbiome. But how do we really improve this so that we know our mind is also in a healthy shape? So as I said, diet plays an important role. So include more like bright, colorful things which have a lot of like antioxidants. So include more fruits and vegetables on regular basis, different variety of them, and cut down on sugar or processed food. So anything which comes out of packet, we all know how unhealthy it is. But again, when we talk about gut or like microbiome, we have to be very particular that, okay, the sugar or the processed food is not coming into picture on regular basis. And there is something called as probiotics and prebiotics. So we will definitely discuss on this, what foods are giving you probiotics and what food is giving you prebiotics. So including them regularly in our eating schedule, in our eating pattern will definitely help. And avoiding antibiotics if it's not necessary. Just for the simple viral flu or for simple things, banking on antibiotics is definitely not a great idea, because that might just take care your issue for a little while, but then it leaves a long impact on your microbiome. And reducing or understanding to manage stress and prioritizing sleep. Again, just not the hours of sleep, the quality of sleep, if you are prioritizing, then definitely it has a positive impact on your gut health. And being physically active. So all these are kind of like helpful, whatever we are talking about, which helps in improving our gut microbiome, has also, I mean, all the actions are also being helpful to manage your diabetes as well. So being physically active, like post meals, taking up your small activities, or bringing exercise routine into picture on regular basis in the morning or in the evening whenever you get time. And avoiding social habits like alcohol and smoking, because we know there is no nutritional benefit which is coming out of these habits. So just restricting or avoiding this completely will definitely have a positive impact on your gut microbiome. So include more vegetables and fruits. Let's elaborate. It's not, when we say vegetables, largely we think, okay, cucumbers, carrots, onion, which we simply like eat on regular basis. But the benefit largely comes into picture when you include variety of them. So each vegetable, each colorful thing which you include in your daily routine in a natural form has its own nutritional benefits. So it could be antioxidants, it could be vitamins, it could be minerals. Each one of them have their own function to act. So I would say including variety of green leafy vegetables on regular basis definitely has a good impact on your gut. And broccoli, again, this is also supposed to be a very good and healthy vegetable. Asparagus, spinach, onions, leeks, garlic. I mean, name the vegetable, you can focus on including them on regular basis. So there are varieties of vegetables which come into picture. Non-starchy category of vegetables is something which you can concentrate here as well. And replacing your sugar or processed food with complex sugars. So definitely, honey is a good alternative when we talk about gut health, because it's kind of like fermented and there is a lot of like good bacteria which is present, but definitely not a substitute like for sugar for a diabetic client. But otherwise, generally, if you ask, like honey would be definitely a good substitute for processed or white sugar, right? But whole fruits, the variety of fruits, because fruits are all, I mean, all the fruits are kind of like sweet and they all come from a background of like carbohydrate section, which is fructose. So that can definitely replace to your sugar or processed food. And again, the vegetables or fruits which are packed with vitamins and minerals to be included on regular basis. And if you see here, the natural sugar which is present in vegetable or fruit versus refined sugar. So when I say refined sugar, what are the options which are coming here? So you can see the chocolates or the candies or the colas, or the content of food which comes out of packet where there is no fiber or like very minimal amount of fiber, less than 1 gram, less than 2 grams of fiber per serving, is definitely not considered a healthy alternative to be included. If you see like honey or dark chocolate or coconut flour, apples, berries, bananas, mangoes, sweet potatoes are definitely a better alternative for your normal sugar or like processed food, right? Rather than including white sugar, you can focus on including these alternatives once in a while, because we largely concentrate on the carbohydrate portion as well. And then probiotics. So again, probiotics are kind of food which has a lot of like healthy bacteria, which enhances the function of gut. And these bacteria are largely helpful to keep our gut microbiome in a very healthy space and for a good digestion as well. So few of the examples of probiotics, I see that curd is like mentioned here. There is fermented food. Fermented food, we can simply talk about like idli, dosa, dhoklas. These are the kind of things which we can include on regular basis. Again, natural sources of probiotics. And the very good and like the very simple source of probiotics, if we talk about it, is a normal curd, which is very easy and which is available like in each and every household. And then there is something called as kefir. Again, kefir is a milk product. So it is being fermented with specific bacteria and yeast by adding it to them. It's very similar to curd. Again, that is a very good example of probiotic. Pickles, when I say pickles, I'm not talking about any processed or ready to eat pickle which comes in a packet form. Definitely, there we have to be particular about salt content, fat content, and the preservatives. But freshly made pickles at home, where you are just like cutting your certain vegetables which you like really enjoy eating and which are very seasonal, you can make fresh pickles at home and you can keep including that in your food. Very good source of probiotic again. So again, rice ganji, it's a very traditional method of like, especially in India, especially in South India, if you talk about rice ganji is one of the like staple food which is included. So again, it does come like with lot of healthy bacteria in picture, which kind again it is considered as one of the good probiotic food. And then kimchi is again a Korean dish where a lot of like vegetables are coming into picture, and it is prepared in certain manner where there are a lot of probiotics present in it. And then there is sauerkraut, which is again cabbage, which is fermented. So again, this will be available if you go out eat, or there are a lot of like recipes which you can make it all of these things at home as well. And there is something called as kombucha. It's a black tea. Again, it is a very good source of probiotics. So these kind of foods you can definitely focus on including on regular basis. And then prebiotics comes with a lot of our food which we eat on daily basis. It can be in grain form, it can be in vegetable or fruit form. So a few of the best sources I have mentioned here. So you can include whole grains rather than refined flour. You can focus on like whole grains. It could be wheat, it could be millets, or it could be rice. All these are good sources of prebiotics which are not refined again. So if it's rice, it is very much polished, then again you will not be able to experience good prebiotic component in it. So unpolished rice is definitely a good source of prebiotic. And then apples, leeks, onions, if in vegetable, if we have to talk, garlic is a very good source of prebiotics. So might be including these things regularly to prepare your food has like positive impact again. So cacao extracts, so dark chocolate you would have seen in the other slide I had mentioned here. So why dark chocolate? Again, there has to be minimum 80% of dark chocolate if at all you're consuming. So because the cacao content is extremely high, that is something which is a good source of prebiotics. And then there is bananas and asparagus as well, which you can include. But again, keeping all your sugar levels in check, these are the foods which can come into picture for your gut microbiome. Only because I'm saying banana or apples, it's not necessary that even though your sugars are at 200, 300, you're ending up having apples or bananas. Always keeping a check with regard to your sugar levels. If it is in safe range, if it is in normal scale, then eating one banana or like half an apple or one apple at a time is absolutely okay. And then avoiding antibiotics. We have spoken enough about antibiotics. So they are used to target bacterial infections within or on the body. So they can attack a wide range of bacteria because they don't know what is good bacteria, what is bad bacteria. So their work is to destroy the bacteria which is present, which is causing an issue. So it can destroy gut friendly ones as well, along with not so healthy ones. So this disruption of our friendly bacteria can result in unwanted pathogens having the room to grow and alter our gut function, leading to several unpleasant side effects. So the impact of like dysbiosis, like I showed you, it could be gastric issue, or it could be skin breakouts, or it could be cardiovascular issues, or it could be diabetes or obesity or cancers. These kind of things can also happen because overuse of antibiotics. And reducing stress or sleep well. So definitely avoiding stress is not in picture because it's not in our hand. A lot of times it's psychological, environmental, or it could be because of sleep deprivation or disturbance into your circadian rhythm. So we need to like really look into things which will really help manage stress. So meditation, breathing pattern, breathing exercises, or yoga definitely helps in managing stress in a better way. And environmental stress, such as extreme hot or heat or cold or noise, you can keep yourself away from. Sleep deprivation, again, if it is on a like regular pattern, it definitely disturbs your circadian rhythm, or like a extreme cycle if you have. Like, okay, weekdays you're sleeping at 10, 11, waking up at like 5, 6, but then weekends completely it's off, then definitely your circadian rhythm is not in place. So we definitely need to take care of these things, that monotony is being maintained when we talk about sleep. So sleeping at same time, waking up at same time, similar time is very important to form a rhythm, because body goes through a recovery process in the night when we sleep. And this circadian rhythm has a lot of impact on hormones as well. It could be hunger hormone, it could be satiety hormone, it could be like digestive hormones and all of those things. So some methods to do so are like, again, for the management of stress, I did mention meditation, yoga, breathing pattern, breathing exercises, and overall exercising regularly or prioritizing at least half an hour, 1 hour of exercise in each single day. And the relaxation techniques, it could be like muscle relaxation techniques. Keeping this in picture will definitely help to keep your gut microbiome also in a healthy space. By being physically active, so increase in the number of beneficial microbial species and also enriching microbial diversity. Physical activity largely helps. The more physically active you are, brain is functioning better. Overall, the gut microbiome or the healthy microbiota or microbiomes are definitely higher. So there are a lot of studies which prove that, okay, there is a good relationship between body fat percentage, muscle mass, and physical activity, which are again significantly correlated and with several bacterial population. So what physical activity is linked by our microbiome? So any physical activity is good, but definitely cardio activity or aerobic exercise where your heart rate is like going slightly higher than the resting heart rate has a positive correlation with gut microbiome. So going for a walk, brisk walk, or a run, or like attending a dance class or a dance routine or Zumba or cycling, these kind of like activities, or swimming, is all considered as aerobic activities or cardio activities. And then about alcohol and smoking, I told you there is no nutritional benefit, which as per se we can say with it, which comes with alcohol or smoking. It definitely impacts and disturbs your stomach and affects H. pylori related disorders, which could be as simple as gastric issue, or it could be irritable bowel syndrome, or this kind of like gastrointestinal disorders. And it could also include the risk of gastric cancer. So in the small intestine and in the colon, alcohol causes depletion of bacteria. So whatever bacteria is present in your intestine or in your colon, it kind of like destroys, with anti-inflammatory activity eventually resulting in intestinal damage, which is called leaky gut. So basically, the absorption of nutrients, which is quite prominent in the gut, it could be in the stomach, or it could be in the small intestine, large intestine. So when you take alcohol, or when you do smoke, the kind of toxins kind of like enters into your gut, and it destroys the microorganisms which are, or bacteria which is present in those linings. And that's how the absorption is also compromised. And it kind of like results in a lot of damage. So healthy gut is equal to healthy life. So yes, now we are open for questions. Let me see. Okay, so there are a lot of questions which we can take it up. Okay, first let me see what are the answers which have come into picture. So now I hope everybody are clear about what is gut. Any which ways, I see a lot of like D, which is being mentioned, which is the right answer. All of the mentioned options come under gut for sure. So yeah. My voice is clear, right? Everybody can hear me? Yes. Can diabetes consume ganji or idli as mentioned in probiotic? Definitely you can, when you tag it with right amount of fiber and protein options. So if you are eating a good portion of sambar, which is made out of dal, can definitely be included, and a lot of vegetables in the form of sauteed vegetable or salad, if you're eating for fiber, it can definitely be considered. Can diabetic person take bananas or pineapples or apple? Definitely you can take, keeping your sugar levels in check. So if your sugar readings are in safe range, in between your meal timings, you can take 100 to 150 grams of fruit with a small portion of nut and seed. Okay, so the presentation will definitely be shared with you all, and the session which is being presented now, the recorded version will be available. If you follow the page, you will be getting to see the recorded session, so you can take the screenshots. So any form of tea or coffee in the morning on empty stomach, it's definitely not a healthy start. So start with something which is natural, like drink water, eat overnight soaked nuts, or eat a small portion of fruit with nuts, and then go ahead with your daily routine. So tea, coffee, best timing would be to take it between your meal timings in a small portion. See, if your coach has told not to take ragi ganji, that is because of the glycemic index. When what happens is, I spoke about rice ganji, which you soak it, the cooked rice is soaked in the night, and then next day morning they eat it as a meal. So in a lot of South India, you see this practice is being maintained because of the fermentation. Because you leave the leftover rice in the night in the water, it kind of like ferments and gives you some kind of like probiotic. And ragi ganji, if we talk about, if you are using the ragi flour and then adding water and cooking it, it forms glutenization. That will increase your glycemic index. So that's the reason ragi ganji, your coach would have asked not to take. Methi seeds with hot water, definitely yes, you can take. Yes. So gut program, healthy gut program, healthy gut plan you are talking about. You can get in touch with your coach, because there is like a meal plan which we kind of like share with the clients, which you can follow at least for 15 days, where a lot of like gut healthy food items are being mentioned on regular basis for you to consume, so that it improves the gut bacteria, and it kind of like helps in restoring your gut. If you have had like a lot of like gut issues, then definitely gut health plan, like healthy gut health plan, meal plan, you can follow for like 1 or 2 weeks at a stretch. Yeah, methi powder or methi seeds. See, methi seeds, if you soak it in the night, morning you take it along with the water. Methi powder, if you are keeping, then you can take it just before your meal or in the morning as well. Like slightly roast the methi seeds, make it into powder form, and you can take that. Yes, dosa, idli, these are one of the good examples of fermented food. So you can definitely have idli or dosa in your daily routine. But it's not necessary only rice to be used for your idli dosas. Your millets can also be included to make your idli dosa. So your jawar, your ragi, your bajra, all these things can be included. Or foxtail millet can also be included. You can soak it, you can grind the flour, and you can ferment it overnight, and you can take it next day morning in the form of idli or dosa. See, about supplements, I would say rather than going to something which is readily like available, why not concentrate on natural foods, which will give you probiotic and prebiotic? Why go for a supplement? But then, if doctor is advising you to take supplement for specific reason, if you are on antibiotic or if there is any other medical condition which is in line, then definitely it makes sense. But with doctor's advice, you have to work on supplements, not otherwise. So, yeah, I'm just going through the questions. Diabetic patient definitely cannot use honey. It's not a substitute for sugar, When we talk about the calories, it's the same as white sugar, but in a rare case scenario, like for example, there is some kind of festival or there is some kind of like sweet which is coming into picture, which is prepared using some kind of sweetness. So in that case, compared to white sugar or processed sugar, honey is definitely a good replacement, but not on regular basis, like you're having your tea or coffees along with your sugar. So IBS is nothing but irritable bowel syndrome. So again, it the symptoms of irritable bowel syndrome can differ from one person to other. So you need to have a proper diagnosis from your primary like treating doctor. Only then you can know. And can I have black gram? So black gram dal can be definitely included. It's not like to be excluded just because you have irritable bowel syndrome. The symptoms are very like individualistic. Some people might tolerate, some people might not tolerate. So there is something called as food map for irritable bowel syndrome. So we need to see what are the food your gut is sensitive towards, and we need to remove from the regular routine and then gradually like introduce in a very like short spaces and see how the tolerance kind of like improves when we equally concentrate on good microbiome. Yeah, I think in cinnamon water, can we use lemon? You can do that. Homemade dahi or yogurt, both are good. If you can make dahi at home, nothing like it. So please go ahead and use slim milk or low fat milk to make your curd, and you can have that. No, it's not necessary that only because you're diabetic, you're not supposed to eat banana. It all depends on what range of diabetic you are, like how much is your sugars. If your sugars are in safe range between 80 to 140, you're maintaining most of the time, your fasting is less than 100. Post meal, when you check it is less than 125, 130, then definitely you can eat banana. Otherwise, also you can have one small banana as a snack along with some nuts and seeds. So only fruits are not enough for the sugars to be avoided to go from low. Protein component is very important. Even though you're fasting, you need to look at fasting, first of all, is not advised for a diabetic person. So if at all you're fasting with doctor's advice, then you need to make sure that before whatever time you're fasting from, before that time, the meal which you take is like quite good with regard to protein portion. And then breaking your fast also has to be like with healthy foods. Please get in touch with your individual coach. They will be able to like guide you very specifically. Yeah, sprouted seeds are very good for diabetes and otherwise also. You can include, it's a good source of protein and fiber. Apple cider vinegar, yes, definitely a very good example of probiotic. You can include apple cider vinegar because it is made by fermenting apple juice. Coconut water in smaller portions, you can definitely have 100 to 150 ml in between your meal timings if your sugars are being in safe range. If you already have like high sugars, like more than 150, then avoid coconut water. More than 2 cups of coffee will definitely be harmful to your health, not only for your cardiovascular problem, for overall health. So don't start your day with tea or coffee, or don't take tea or coffee post sunset time. For your the good benefits of tea and coffee, because they also give you like good amount of antioxidants, take it in between in the day, like somewhere around 11 or 12, or somewhere around 3 or 4 in the afternoon, you can take a cup of tea or coffee. So apple cider vinegar, there are different ways it can come into picture. So you can take it, mixing it with water, like on empty stomach or just before having your meal, 10-15 minutes before having your meal, you can take apple cider vinegar, or even bedtime you can have. Or if you're eating salads before your meals on regular basis, then you can like use apple cider vinegar as a dressing. So sprinkle 1 or 2 teaspoons of apple cider vinegar into your vegetable bowl. Mix it well and then consume as a salad in the beginning of your meal. That way also you can do. So taking tea in nighttime, is it good? Definitely not. Just now I said, so tea and coffee to be consumed in a healthy time, that is between your meal timings. Don't take tea or coffee after sunset. Post 5 p.m., it impacts on your sleep cycle. So, impact of vegetarian and non-vegetarian food on diabetic patients. So, vegetarian food, again, when we largely talk about protein, which is coming in from our non-vegetarian or animal source, it's kind of like complete protein, we would say. It's all depending on the choice. If you are a non-vegetarian, then I think eating in a small portion, which is kind of like balanced with all your daily eating habits, it's absolutely fine to include. For a person who's not eating non-vegetarian food only because it is good source of protein, we cannot ask, because there are equally plant-based protein foods which are available. It's just that you need to work on a lot of like variety. Yes, you can definitely eat ragi, jawar, bajra, all of these things. Yes, vitamin B12 and gut health has a strong correlation. So we need to make sure vitamin B12 levels are in safe scale or managed well, so that the gut microbiome or the good bacteria is present and it's doing its work to its max. That's a very good question put in by Mr. Gopal Krishna. So, how to cure IBS, especially triggered when in tension? If you say, as I said, we cannot run away from tension or stress, but we can definitely work on managing stress in a better way. So, yoga, mindful practice like breathing exercises will definitely help. Whenever you have like anxiety levels or like very tensed, I think you need to just sit down, relax yourself, and focus on your breathing. This helps largely to maintain your irritable bowel syndrome as well. And then look at the food which kind of like causes disturbance and stay away from those foods for a period of time. Definitely not. Dark chocolate can come into picture once in a while. As like if you have a sweet tooth, you feel like eating something sweet. So might be weekly once or twice eating a small piece of dark chocolate should be good. Apart from dark chocolate, many other things which you can pop it in mouth when you have like a very bad sweet craving, rather than eating like a normal chocolate or desserts or sweets, you can always chew on one cardamom that will take care of your sweet craving, or put 1 teaspoon of sawn seeds in your mouth soon after your meal. That will take care of your sweet craving. Or have one date or couple of like 2 3 raisins in your mouth. These things will be helpful rather than just taking dark chocolate always. Chamomile tea, yes, chamomile tea helps in melatonin production and it helps relax your mind as well. So that is something which you can take it in the night. It doesn't have any tea as such, it's a dried flower basically. So you can boil those dried flower like petals in water and sip that water just before sleeping. It helps in better quality of sleep as well. See, vitamin D and vitamin B12, these two are king and queen of vitamins. So let me tell you, the absorption of vitamins and minerals happens in the gut. So when there is not enough vitamin D or not enough B12, then you know that okay, microbiome is also not in a like a healthy space. So it's very important to keep your vitamin D and vitamin B12 in safe ranges. 6 to 8 times we can drink sugarless coffee or tea. Definitely not. I told you once or twice maximum in a day you can have tea or coffee. Not more than that, even though it is black tea or whatever it is, because tea comes with tannins, coffee comes with caffeine. It has an impact on your nutrient absorption. So more than 2 cups is definitely not good in a day. Okay, so as much as possible, I have answered to all your queries. I'm just going through. Okay, it's right. Papaya. Okay, papaya is fine. You can take it as a fruit. Papaya can be included as a snack. As I was just talking about banana, similar would be papaya as well. Along with some nuts and seeds, you can definitely include. I think Mr. Amita, please get in touch with your coach. She will be the right person to tell you about, since you have got an ileostomy in October, I think she will be the best person to guide you how to take care of it. Because I don't know the back history or present how you are eating your meals, all those details I do not have. So I will not be able to give you like a random answer for this. See, yeah, I mean, coconut milk curd, Mr. Sri Risha has asked. So definitely, yes, any kind of like curd. In soya milk, you can make curd, or in normal milk, you can make curd or yogurt. Even in coconut milk, if you're making a curd and you're including, that is good. That's a good source of like probiotic. So dates and figs come under dried fruit. So good amount of glucose in it, good amount of like carbohydrate in it. So very mindful on how much portion you include. Definitely not on regular basis. Once in a while for your sweet craving, you can pop in like might be one date or one prune or one fig. Not every day on regular basis. Tea or coffee, 1 or 2 cups a day. About green tea also, it remains the same. 1 to 2 cups a day can definitely be taken. If you feel like drinking or sipping fluids on regular basis, you can always look for some detoxifying teas like ginger water you can sip, zira water you can sip quite frequently. These have positive impact on your health. Yes, almonds you can take handful of them, 3 or 4 if you're eating almost every day you can eat. If it is early in the morning, you can soak it overnight, remove the skin and take it for better absorption and digestion. So thank you each and everybody who have been here and who patiently like listen to all the things which we have discussed for today. Thank you once again. We will see you all again next Sunday, similar time with a new topic. So, yeah.
Thank you so much, Ramaya, for this session. It means a lot, and I hope you all enjoyed it. Your queries are resolved. So, in case there is anything you can write down in the premium group, I request everyone to stay active on the premium group. Thanks a lot.